Hi, everyone. Welcome to our bonus session of this webinar series on healing IC. This is a special session that is all about answering questions that you have or that have come up during the course of surveys that actually date back to February of this year. And so these are questions that have been commonly asked and have asked for answers, and some of them I've been able to respond to, others, and most of them haven't, but unless they're answered in blog posts, etc. So this is a kind of a survey of the utilization of information of the energy science of Ayurveda. There are many different things that really don't nestle themselves into categories, such as, using aloe vera gel or CCFT or castor oil and these kinds of things. These they tend to be more around questions of a more general nature. And so why don't we get started? If we can get this slide to advance, we'll be able to, oh yeah, there we go. So some questions have come up about biological energy. That is, what is energy work? What is this all about? And Einstein said 100 years ago, E equal mc squared. He said that we are with this particular equation that's now very famous. He essentially said that energy and matter are interchangeable at a constant. What this says is that we are both simultaneously a matter and an energy field. That is, we are a collection of molecules that we measure, and we're also an energy field that expresses itself through the matter field, through the molecules that we see. So, for instance, estrogen and the biological marker for prostate cancer, PSA, are expressions, molecular expressions of the energy pattern of pitta, or of the hot quality. So they measure, in excess, they measure inflammation. That's, in essence, what we're talking about here. Another way of looking at the biological energy field is to see the body as a battery. And so you know that if you put a new battery in your car, that it provides energy to the rest of the car systems, its computers, its transmission, its brakes, its what you see on the dashboard, etc. But what happens if you forget to turn off the light in the driver's compartment, in the cabin of the car, and you leave that on for several days? Well, then the battery gets drained of its energy. And actually, this is what happens to the biological field when chronic disease occurs. Chronic disease drains the biological energy field. It makes it less resilient, having less stamina, less endurance. And all of you who are listening to this have experienced, to some degree or another, this loss of biological energy. So it's a very common thing that occurs. Now, having said that, there are some chronic disease states, such as chronic diabetes mellitus or other disease states, that don't seem to drain the body's energy as much as in other diseases such as interstitial cystitis, fibromyalgia, irritable bowel syndrome, GERD, or chronic hyperacidity syndrome. All of these types of system or disease states have some degree of loss of that biological energy, more so than others. But nonetheless, the concept is still the same. There's a drainage of the energy from the field, and you have all of the symptoms that are related to that. So the idea about chronic disease in general is that we want to build up that biological energy again. We want to charge the battery. And in some cases, actually, we want to change the size of the battery to a larger size. That is to say your battery size happens to be a 4-volt battery, and that's really not adequate to drive your car anymore. So if you change to a bigger battery, say to a 12-volt battery, then you have the extra oomph, the extra energy to be able to do your thing on a regular day-to-day basis. And so what are some of the things that you can do in order to build up biological energy? That is, change your battery to a larger size. One of the things that the energy science says is that pranayama, or the science of the breath, that's what it really translates to, or more precisely, the science of the biological energy. That's what prana is. Prana is a name for that biological energy. When we study and do work around building our battery size, we build better resilience, we build stamina, we build endurance, and all of these things help us recover from our debilitated condition, our debilitated state. And no question about it, you all know this, that interstitial cystitis is a debilitating disease. And one of the primary reasons for that is that it drains your biological energy field. So we want to enhance that biological field. We want to get it stronger. We may want to make it so it has more oomph, so that it's capable of running more systems in your body rather than just trying to get by. This does not happen just because you hope for it. As you already know through our first 4 sessions, this kind of work does not happen just because you hope it will happen. You have to do something about it. And this kind of model that we're talking about, the Ayurvedic model of the energy science, will help you become more facilitative in terms of doing this kind of work to improve your health, because in the end it's all about enhancing your health and getting you back on the road to recovery. So the value of the energy science work, as we're talking about it, is that it articulates methods and gives you tools by which you can become a stronger energy field. We've talked a lot about nutrition, herbs, the use of herbs for eliminating or reducing markedly the pain complex that occurs with flares, etc., etc. But this other aspect is a different type of way of looking at the way to help yourself heal yourself. Now, the second thing to do is to stop the drainage of energy from the body. Now, one of the ways to lose energy is a common way that we all know about is diarrhea. Diarrhea is the slow loss of energy from the GI tract. And what that does is it saps the body's energy and drains the battery, so to speak. So there are different things that you can do in order to stop the drainage of energy from the physiology. The first is just to do simple fasting. Now, fasting from an energy science perspective is a very broad range of things that you can do. You can do a water fast, you can do a juice fast, you can do a khichdi fast that we can talk about in our next session. But the bottom line here is that the fast not only is about the type of materials that you're using on a regular basis, but it is also related to the type of the length of or duration of the fast. So, you know, some people do a juice fast for one day and then they're good. They go back on their regular diet the next day. That's a very good way to do things on a routine basis to help you recharge your battery. But sometimes people will do, say, a khichdi fast for, say, a week or so in preparation for other things in terms of cleansing. But sometimes they may use khichdi, this very easy to digest food material that can be done for literally as a regular diet. There's nothing wrong with using khichdi as a regular food unless you are going out to eat with friends or you happen to be going out to eat. These are all times when you wouldn't use khichdi, but when people get back home and they settle into their routine again after travel or whatever, they would go back on a khichdi routine. We'll talk about khichdi tomorrow. Right now we don't really have enough time, and people haven't really expressed an interest in this kind of mode of therapy, but it clearly is a therapy in terms of helping one's Agni that we've talked about in the past, and also helping the digestive system become more balanced. Another thing that we can do in order to stop the drainage of energy is to just slow down, to decrease the mobile quality in our lives. This is a highly important and extremely valuable technique because what happens when we get too much of this mobile quality is it translates into interstitial cystitis, because as we now know, the hot and mobile qualities are those qualities that if they are in our energy field in excess and you have the predisposition to interstitial cystitis, they will impact your symptoms. Many people on threads now have asked, why is it that when I'm really busy and I'm under stress that my IC symptoms get worse? And this is exactly the reason. The mobile quality produced by excess stress leads to an increase in the symptoms of urinary frequency, urgency, and sometimes incontinence. So there you have it. It's a very simple correlation between symptoms, lifestyle, and the quality in the physiology. Now, having said that, why is it that the stress causes the mobile quality? Well, it's because the mind becomes upset in this situation. The mind becomes active, overly active, and what happens is that this mobile quality dominates in your physiology, leads to your urinary symptoms. The biggest drain from the biological energy field is the mind. If you quiet the mind, then you have more control over this mobile quality that occurs in your life. The biggest way, or the best way, to quiet the mind is through meditation. And that's why meditation is catching on. We live in such a aggravated, mobile society where everybody seems to be talking about their stress levels, etc., etc. And the reason that meditation is becoming so popular is because people are looking for ways to manage this mobile quality in their life. And suffice it to say, as you probably have already surmised, the mobile quality is what delivers degenerative disease. So we've got to, as a society, as groups of people, as individuals listening to this, have to, in some way, start handling this mobile quality. There are many, many, many different techniques to meditate. But I can tell you that it doesn't require any special tapes. It requires no special tools. You don't have to have a special place to go. You have to have two things in order to meditate. The first is quiet the mind. To quiet the mind is to the ability to close your eyes. The second is some place to sit. If you have those two things, you can meditate. So you can see that you can meditate in your car, you can meditate on the airplane, you can meditate on the train, you can meditate in your bedroom, laying down when you get up in the morning or when you go to bed at night. So any place is possible as long as you are able to close your eyes. So the second thing is that meditation is best done twice a day, morning and evening. So you bracket the day's activities with meditation. You go into the day with a quiet mind, and at the end of the day, you drain all of that mobility, all of that activity that's going on in your physiology. You drain it at the end of the day. When you drain the biological energy fields like a 4th of July sparkler, just all kinds of excess energy is coming off your physiology. And then you have a good night's rest, and you wake up in the morning fresh, ready, and renewed to start the day with yet another meditation to drain off any excess energy that did not get dissipated through sleep and the dream state, because dreams are actually a way of the body to release pent-up energy in the biological field. So that's all about the aspects of meditation. We can talk about that more in detail if people are interested in threads. The second question that comes up a lot is the issue of constipation. First of all, I think we have to define what constipation is. The allopathic tradition, even gastroenterologists, do not really define constipation very well. But it's clear from the energy science what constipation is. Regular AM bowel movement on a regular basis, and then 1 to 2 hours after the biggest meal at noon. That usually is the noonday meal. It should be, at least. When you have excess dry and light qualities in the lower colon particularly, when these dry and light qualities become increased, then the result is a dry mucous membrane or a dry mucosal surface of the lower bowel. This dryness and lack of lubrication, along with the light quality in the colon, leads to problems with constipation. It's the end result of these two qualities increasing in amount that leads to constipation. Now, let's take a look at a common problem that can occur in IC called irritable bowel syndrome. And in that situation, what happens is there's a rush of small bowel contents into the colon. Well, what that actually is a rush of the hot quality coming into the colon, and it overwhelms and stimulates, that hot quality stimulates the colon. And the colon then releases, because of the hot quality, releases rapidly bowel contents. What that hot quality, however, does is it causes dryness and it causes lightness in the colon. So after diarrhea occurs, then constipation ensues because of the dry and light qualities. Then another wave of hot quality comes through, dries the colon, causes the light quality, and constipation ensues. Then diarrhea occurs, constipation as a result. So now you can see that the full appearance, the complete clinical syndrome of irritable bowel syndrome is merely expressed in alternating hot and dry light qualities. Hot, dry light qualities. Hot, dry light qualities. What this leads to is intermittent diarrhea and constipation. And this is the complete, full expression of irritable bowel syndrome. It will never be able to be described in terms of the molecular or matter field science. But from an Ayurvedic or energy science perspective, it's clear that alternating intermittent constipation and diarrhea are nothing but expressions of these qualities out of balance in the gut. The best treatment for constipation is Triphala. And we've talked about this in one of the blogs. If you want to go back and take a look at that, it would be on icsolutions.com. The Triphala is used in such a way as to induce a bowel movement in the morning. If all other aspects are created equal, Triphala can remedy simple constipation. It's the best bowel tonic that the energy science has to offer because it balances all three of the energy patterns, Vata, Pitta, and Kapha. 1 to 3 teaspoons at night before bed will get you induced in order to have a bowel movement in the morning. You just simply titrate up from actually a half a teaspoon to 1 to 1.5, 2, 2.5, 3 teaspoons until you get more normalized. The other thing that we should do and pay attention to is drinking enough fluids according to our energy makeup. So Vata should be drinking 70 ounces of fluid a day. This includes fluid with meals. Pitta 50 to 60 ounces and Kapha 40 to 50 ounces a day. So those are fluid guidelines that we talked about in session 1. We've talked about irritable bowel syndrome now with respect to IC and how the hot quality becomes the leading characteristic that produces the dry and light qualities, leading to constipation and the diarrhea related to the irritability of the colonic wall. There's oftentimes questions about intimacy, and one of the common things is when to resume intimacy. When is it safe? Well, it's really up to each individual in terms of how they see their symptom complex. But as time goes by and we release the hot and mobile qualities from the lower urinary tract, from the bladder, and we get control of the ama, which is holding these qualities in the bladder area as well as in the vagina and the genital tract, we get a chance then to release these qualities that then will allow you to start resuming intimacy. But there is no, rule of thumb. There's no way of predicting how it's going to go for each individual, because you just can't make those kinds of predictions, because everybody is unique in terms of their disease expression. And it may take some people, 6 months of doing this kind of work, where somebody else might be able to resume intimacy within a month or so after doing this work. So it all depends on where we are with respect to our interstitial cystitis and associated disease states. So it's trial and see how things go. That's the best we can do. There's a question about this connection to endometriosis. From an energy science perspective, there is no labels in diseases. There are only imbalance of qualities. So the energy science doesn't try to label a disease and say, this is interstitial cystitis. What it says is, how it would describe interstitial cystitis is that it's an imbalance of qualities, primarily the hot and mobile, that get lodged and stuck in the urinary tract channel and then leads to obvious dis-ease or disharmony or problems in the urinary tract that give rise to these symptoms that you have. These same hot qualities can occur in the GI tract. Concomitantly or at the same time they're occurring in the urinary tract. And then they cause GERD or hyperacidity syndrome, heartburn, acid indigestion, and as we talked about earlier with irritable bowel syndrome, the hot and mobile qualities can be disturbed downstream in the GI tract, in the small bowel, hence leading to irritable bowel syndrome. So that's why there's an association with respect to irritable bowel syndrome, GERD, or hyperacidity syndrome, and IC. It's a very high correlation. And, of course, from the matter science model, there's no way to describe that. All we have done in the matter science is simply labeled the disease. What happens in the energy science world, however, is it does away with the labels. There's no reason to have labels because these qualities are everywhere. The same thing happens with fibromyalgia. Fibromyalgia and interstitial cystitis, again, have a high correlation. About 30% of people with IC have fibromyalgia. Well, why is that? It's because these hot and mobile qualities are now seeking places such as the joint spaces or in the muscle layer, and hence fibromyalgia starts occurring. But again, it's just simply from an energy perspective, energy science perspective, it's simply these qualities have disseminated to other parts of the body. And so that leads us up to how is this connected with endometriosis? And I think you can then see that if these hot and mobile qualities get into the genital system, the ovaries, fallopian tube, uterus, and vagina, then this genital association with genital tissue association with the hot and mobile qualities drives the diagnosis of endometriosis. And in the male, it would be associated with chronic prostatitis. But think back now, the urinary tract has the hot and mobile qualities that are delivering the symptoms of interstitial cystitis in the bladder channel, in the urinary tract channel. And these hot and mobile qualities then cause all of the symptoms: urinary frequency and urgency and incontinence and burning on urination, burning in the pelvis. And what happens in the female genital tract is that the female ovary and vagina start becoming involved, and this system then produces symptoms of vulvodynia, pain in the vagina, maybe pain in the pelvis, and hence you start seeing the possibility of a doctor making a diagnosis of endometriosis, when in reality it's not endometriosis. It's simply the hot and mobile quality showing up in the lower genital tract of the female. In the male, it becomes chronic prostatitis. So the prostate becomes involved with the hot quality and the mobile quality. Symptoms from the urinary tract resolve with antibiotics, because antibiotics are an anti-inflammatory. They reduce the hot quality in the urinary tract channel of the male, but the hot and mobile qualities still reside in the prostate. And so men can have symptoms of the prostate being involved with hot mobile qualities, yet they don't have any urinary tract symptoms. So, and then they do sometimes. So it's a mix. It's a mix. But we have to keep these two different types of energy, two types of energy anatomy separate from one another in order to understand what's happening. One is involved in the urinary tract channel, the other is involving the genital tract. Now, having said that, if someone becomes asymptomatic with respect to the urinary tract channel because the hot and mobile qualities held there by AMA are leaving the body, sometimes then that leaves nothing but vulvodynia in place and the pelvic pain present. And so then there may be this issue of genital tract hot and mobile quality that is present without the urinary tract channel involvement. And oftentimes that occurs because the genital tissue is slower to release the hot and mobile qualities. You know, in endometriosis, commonly what happens is the woman shows up in the doctor's office with negative urine cultures because of the hot and mobile qualities. They're given antibiotics over and over again until finally the doctor throws up his hands and said, "You must have endometriosis. Go to your go to this gynecologist." So you go to the gynecologist. He does a pelvic examination. He finds tenderness. He looks at your story and he says, "You need a laparoscopy." So then you get a laparoscopy. He says, "Oh, I see changes in your peritoneal lining consistent with endometriosis. That's what you have. That's what you have." And so a lot of time is lost when this kind of approach occurs. So what I would suggest is that pelvic symptoms with negative urine cultures should always be treated as interstitial cystitis first with energy science techniques. And then if things don't correct themselves, then my approach would then say, okay, go see and get laparoscoped and have biopsy confirmation that you have endometriosis. The pattern should be reversed if it's just IC. And if there is no response to therapy, and endometriosis then should be entertained secondarily, not as a primary diagnosis. So anybody who has pelvic symptoms should be considered first to have IC, and then secondarily should be treated as endometriosis. So this diagnosis, as we said, can be done laparoscopically, but we should expect a tissue biopsy evidence of endometriosis, not just a visual inspection. This can lead you down the primrose path of mistaken diagnoses. So biopsy evidence of endometrial implants is really a must. You cannot make a diagnosis of endometriosis unless you have a biopsy. Otherwise, it's a tenable diagnosis. Some people ask about how to manage flares on vacation. You know, the mobile quality, as we talked about earlier, gets disturbed when there's a lot of movement of the body, but particularly of the mind. When the mind is thinking a lot of, trying to juggle a whole lot of different things all at once, then that causes the mobile quality to increase, particularly if you're not doing things to bleed off that quality, such as meditation or diet or any of the other methods that we've so far talked about. So the mobile quality gets disturbed because of the movement. And so it's not uncommon for these symptoms to occur during vacations. And we talked in session 3 about the emergency flare kit, which would be bringing castor oil along, bringing essential aroma oils that you can use for aromatherapy, maybe even bringing along a enema bag, which you can use to do vaginal douching, because vaginal treatment with targeted herbal therapy can be very, very effective for treatment in flares. And if one is capable of doing intermittent catheterization, even if you're on a boat in the middle of the Caribbean, you can do intermittent catheterization in the privacy of your compartment, and then use that as targeted therapy to help deal with your disease. Commonly asked question is, will my bladder ever heal? Is it possible that the bladder will be normal again? And the answer to that is unequivocally yes, it will be normal again. You just have to do the work and be patient. That's the key. Perseverance of this work with patience is the key. IC is curable, not just treatable. Even if you have Hunner's ulcers that are present, if you're doing this work on a regular basis, you should gradually resolve these qualities that are isolated and affecting your bladder. But this takes time, and doing 2 months of energy work for every year of imbalance is kind of giving you a rough rule of thumb. So for every 6 years of symptoms, it means that you'll have to, 6 times 2 is 12 months of work in order to get a handle on this problem. And as time goes by, this will gradually resolve your issues, just that you have to pay attention to the details involved. And as we've talked about in the past, it's all about baby steps. It's all about simply taking the time to gradually move in the direction of doing this energy work. Some people have asked about the tastes involved in the Ayurvedic or energy science tradition. Basically, the sweet, bitter, and astringent tastes are aggravating to interstitial cystitis. They're beneficial for interstitial cystitis. And it's because the cold, heavy, slow, dull, and dense qualities all reduce the hot and mobile qualities. On the other hand, the sour, the salty, and the pungent tastes that are common in fast foods give you the hot and mobile qualities. So obviously, since you have an excess of hot and mobile in the physiology, and particularly targeting your bladder and bowel, these qualities then need to be eliminated from the body, and adding more sour, salty, and pungent is going to be detrimental to being able to release these qualities. I mean, if you have these qualities in excess and you keep adding more and more of them, obviously you're just getting behind the 8-ball, so to speak. Now, having said that, it's quite easy sometimes to know what the sour tastes are. You know, I use lemon juice, or I use vinegar, etc., etc. All of these types of sour tastes are the acid taste in nature, and so we obviously would want to avoid the sour taste or the acid taste in foods. And the same is pretty much true with salty. I mean, it's really not hard to try to figure out which things are salty. I mean, soy sauce is salty. Putting table salt on your foods, that's also a problem. And the same thing is true for pungent. Pungent is actually a taste in the energy science tradition, not really noted as is astringent in the Western or allopathic tradition, but the pungent taste is also hot and mobile. And so this comes from hot chilies, cayenne pepper, chili pepper, horseradish. These are all pungent tastes. But some of these three tastes are sometimes not so apparent when you're taking foods in. And so there are aspects of sour, salty, pungent in foods that you might not recognize. And that's why it's so important to follow the nutritional formats that we've talked about in all of this work that I'm describing. So it's pretty easy. You just stay out of fast food stores. But the other thing is follow these nutritional formats so that you can more easily avoid the hot and mobile qualities that happen to be present in foods that are not so obvious to you. Well, that's all I have for today, and I'm hoping that this has helped clarify some questions or brought up some information that that you're interested in that we can talk more about on our next call this coming Tuesday. I appreciate your attention, and best of everything. Have a great weekend, and we'll talk to you next Tuesday. So long for now.